In the headlines, an apparent hit and run has led to the island's first road fatality for the new year. The Ministry of Health records 15 new cases of COVID-19, and a local psychiatrist highlights the pros and cons of the temporary suspension of alcohol licenses. All this and more coming up in tonight's broadcast.
This is the Hot 7 Nightly News with Lovelace and Amy Joseph.
Good evening. It is Friday, the 22nd of January 2021. Welcome to the Hot 7 TV Nightly News. We're on Flow Channel 117, also being simulcast on Kiss FM 105.5 and 105.9 radio. I am Rochelle Gonzalez, standing in for lovely St. Amy Joseph. Thank you for tuning in. St. Lucia has recorded its first road fatality for the year 2021. At approximately 7:08 p.m. on Thursday the 21st, the Vieux Fort Fire Service responded to an emergency call for an individual who was a victim of an apparent hit-and-run accident on the Vieux Fort Labrie Highway. Fire Service personnel Damien Jabatis gave the details.
The ambulance crew came upon a John Doe who was found to be unresponsive, pulseless, and not breathing. He was rapidly packaged and transported to the St. Jude Hospital, where he was handed over to medical staff. His condition remained unchanged.
The individual has since been identified as Shane Lawrenson of Vieux Fort. The fire service also responded to a vehicular accident in Micoud.
Micoud Fire Station received a call at approximately 9:22 p.m. from the police control room, informing of a motor vehicle incident near One Stop Minimat at Pasias, Monripo. The caller indicated that a jeep and a bicycle were involved. The responding crew discovered that a Suzuki jeep had come into contact with a bicycle in a head-on collision. The 22-year-old male rider of the bicycle was assessed. He complained of pain to his legs. He was treated and transported to the St. Jude Hospital, where he was handed over to medical staff in a stable condition.
That was Fire Officer Damien Jabatis. On Friday, the 22nd of January 2021, the Ministry of Health and Wellness received from the Ezra Long Laboratory confirmation of 15 new cases of COVID-19 from a batch of 112 COVID-19 tests. The Ministry of Health also reports the recovery of 4 cases of COVID-19. This brings the total number of active cases in country to 342 active cases. 1 case is in critical care and the others are all stable. This brings the total number of cases diagnosed in country to date to 770. All cases are nationals who range in age from 9 years to 68 years. 2 cases are from the Ancillary District, 8 cases are from the Castries District, and 5 are from the Grosley District. All these individuals have been seen at community-based respiratory clinics where they were assessed and tested for COVID-19. As per protocol, they were placed in quarantine by health practitioners whilst awaiting their COVID-19 test results. Arrangements have since been made to place these individuals in isolation upon being diagnosed with the virus. The contact tracing team is presently undertaking investigations to identify the contacts of these confirmed cases. In other news, the sale and consumption of alcohol is now prohibited for the next 21 days. Whilst many are averse to the banning of alcohol, local psychiatrist Dr. Julius Gilliard says it is not a bad thing. He says, however, the manner in which it keeps getting done may be a bit problematic and may lead to other complications that the already strained healthcare system will not be equipped to handle.
Effective Wednesday, 20th January 2021, the government of St. Lucia issued a 21-day ban on the sale and consumption of alcohol. Many have expressed outrage over the fact that the substance will not be available in any licensed operation. Local psychiatrist Dr. Julius Gilliard told Hot 7 that the notion of banning or trying to prevent people from drinking alcohol is actually not a bad one, more so during the pandemic, as the World Health Organization has recommended.
Alcohol reduces our immune system. Alcohol causes us to be more disinhibited, more aggressive, and so banning it, yes, is recommended. But a short-term ban, what are you going to achieve? It's just going to have persons starving, craving for alcohol for 3 weeks and then lift the ban back to square one.
Gilliard says, however, lessons should have been learned the first time there was a suspension of liquor licenses.
Yes, we have difficulties with alcohol consumption in St. Lucia. What happened the last time alcohol was banned? So it was banned for, I think it was a month or so last year. And so persons managed to stay away. But what happened when the ban was lifted? You had a significant increase in consumption. I think all supermarkets and bars were filled with persons going to look for alcohol. So banning alcohol for 3 weeks, what are we going to achieve? Yes, the rate of COVID may increase now, but then when the ban is lifted, we're going to have a surge in alcohol consumption, which may put a further strain on our health system.
He says there are many issues coming out of the abrupt ban that the healthcare or social services system may not have enough resources to deal with.
How are we going to service the persons who are alcohol dependent? We may see an increase in visits to our emergency rooms or our mental hospital. How are we going to deal with that? You're going to see an increase in backdoor consumption of alcohol, and that puts those persons at risk of a lot of things. Maybe alcohol poisoning. Persons may want to mix alcohol with methyl alcohol with the ethyl alcohol. So a lot of things may come out of this. I'm not sure what the government looked at before they implemented the ban.
Gilead says while sites are on the ban of alcohol solely for a short stint to help lessen the spread of COVID-19, the bigger picture is getting individuals to stop being so dependent on the addictive substance. Reporting for Hot 7 News, I am Genevieve Gonzague.
The St. Lucia Tourism Authority has acknowledged the Center for Disease Control and Prevention's recent alert for American citizens wanting to travel to St. Lucia. On Tuesday, January 19th, the CDC issued the highest level of alert to American citizens, Level 4, warning them to avoid all travel to St. Lucia. Jeraine Georges is the SLTA's Public Relations Manager.
With the increased number of cases and the current active number along with the transmission noted, we understand the CDC's position in rating St. Lucia at Level 4. We must, however, as a people and tourism destination, continue to adhere to the protocols outlined by our health authorities so that we can all be kept safe amid this pandemic. This is certainly an unprecedented time, and noting the measures that were announced today by the government for scaling back, we look forward to better days ahead for us all, and not just for the tourism sector, but for all related sectors, as we know that ancillary service providers contribute significantly to tourism.
Key information for travelers to St. Lucia from the U.S. states that travel may increase the chance of getting and spreading COVID-19. The CDC tells citizens to get tested with a viral test 1 to 3 days before their trip. Do not travel if you are waiting for test results, test positive, or are sick. Follow all entry requirements for your destination and provide any required or requested health information. Stay with us, because still to come on Hot 7 TV, the SLT reacts to the closure of schools. A fitness instructor warns parents to keep children fit as they remain at home. And Rise St. Lucia Safe Spaces has a new leader.